Hello everyone. In this tutorial we will see the features of the scalp. So scalp is the part which extends from eyebrows and which extends till the external occipital protuberance in the back or in the posterior part. This scalp, it has got 5 layers which can be easily remembered through the mnemonic of the same name called as the scalp, where S stands for the skin, where C stands for the subcutaneous tissue, A stands for a layer of aponeurosis, L stands for loose auricular tissue, and the last layers P stands for pericranium, which is nothing but a layer of the periosteum. So these are the basic 5 layers: the skin, the subcutaneous tissue, the aponeurosis layer, the loose auricular tissue, and the pericranium. So if you see the layers, the first layer is the layer of skin. So the skin is quite thick here, but do remember that it is not an example for thick skin, it is an example for thin skin, because the skin contains numerous hair. It contains a large quantity of sebaceous glands and the sweat glands and a thick amount of hair that is present here. Whereas the next layer, that is the subcutaneous connective tissue. This subcutaneous connective tissue, it is basically a connective tissue layer which contains some amount of blood vessels, and even some nerves are present here which is supplying the skin. So the blood vessels are numerous here. The scalp is one of the highly vascular structure. So the third layer is basically called as the aponeurotic layer. So there will be a layer of aponeurosis, and this layer, it also contains 2 muscles which are called as frontalis and the occipitalis. So it is depending upon which region it is present. Frontalis is present in the anterior part, occipitalis is present in the posterior part. So if you see the attachment of these muscles, so there will be a layer of aponeurosis in between, and to the anterior part of this aponeurosis, or from the anterior part of the aponeurosis, there will be attachment of frontalis muscle, so which is attached on one end to the aponeurosis, which is also called as galea aponeurotica. In the anterior part, the speciality of the frontalis muscle is it is not attached to any of the bone. Rather, it continues with the muscle over the nasal region, which is called as the procerus muscle. So there is no muscular attachment in the frontal end. Whereas posteriorly, there is one more muscle attached to the galea aponeurotica, so which, as I already described, it is called as occipitalis muscle. So this occipitalis muscle, on one end it is inserted into the aponeurosis, whereas it takes origin from a point in the posterior aspect of the occipital bone, which is called as highest nuchal line. So what is the function of this occipitalis and frontalis muscle? So frontalis muscle, when it contracts, so it will pull the skin that is present in the forehead region, or in other words, it will elevate the eyelids. It produces horizontal wrinkles in the forehead region. Whereas the occipitalis does the same in the posterior part, not a major function in this region. So this is the third layer which contains galea aponeurotica, frontalis muscle in the anterior part, and occipitalis muscle in the posterior part. So all these 3 layers, that is the skin, the subcutaneous tissue, and the aponeurosis, they are almost fused with each other and they move as a single unit. So beneath this aponeurotic layer, there will be a layer of loose auricular tissue. As the name suggests, it contains loose connective tissue that is present here. So it is on this loose connective tissue, all these three layers will move. And even this loose connective tissue, it contains some blood vessels which traverse through the loose areolar tissue and reach the remaining layers. So apart from this, it also contains some veins. And even nerves will traverse through the loose areolar tissue. So beneath this loose areolar tissue, so there will be a layer which is called as the pericranium. So this pericranium, it is nothing but periosteum of the skull region. Beneath the pericranium, there will be of course the skull, and beneath the skull there will be some dural venous sinuses. So which are nothing but the veins that are present in relation to the dura mater or around the brain. So in this aspect, there is one important vein which connects this dural venous sinuses with the veins that are present in the loose areolar tissue. So it pierces or it passes through the skull and the pericranium, and it connects the dural venous sinuses with the veins of the scalp region. So these structures or these veins, they are called as emissary veins. So what is the function of this emissary vein? Why it is connecting the extracranial veins with the intracranial dural venous sinuses? If there is any increase in the pressure in the dural venous sinuses, there is no space within the skull cavity or within the cranial cavity to accommodate that pressure. So that pressure is transferred through the emissary vein into the veins that are present in the outer aspect. So that is the major function of the emissary vein. It maintains the pressure balance between the extracranial veins and also the intracranial dural venous sinuses. So what is the disadvantage of having this vein here means? So if you see the layer of the loose areolar tissue, it is very much superficial. Just it is covered by 3 more layers of the scalp. So any infection in the loose areolar tissue, it can traverse through the emissary vein and enter into the dural venous sinuses, leading to infection of dural venous sinus. So that is one of the negative aspect of the emissary veins, and for this reason the entire loose areolar tissue, it is called as dangerous area of dangerous area of the scalp. So that is one negative aspect of the fourth layer. So the dangerous area of the scalp is nothing but the fourth layer, which is the loose areolar tissue. So these are the various features of different layers or 5 layers of the scalp. So apart from this, what all we should know in the scalp means what are the nerves that are supplying the scalp, what are the blood vessels that are supplying the scalp, and what is the lymphatic drainage of the scalp. So first, if we see the nerves that supply the scalp region. So all this neurovascular supply, we divide it into the supply in front of the ear and supply in behind the ear. So the ear is considered as the landmark for dividing the nerve supply and even the blood supply, which includes the arterial and the venous drainage. And in the front region, so it is anterior to the ear, there are 4 sensory nerves and 1 motor nerve. Similarly, on the posterior aspect also, there are 4 sensory and 1 motor nerve. And this motor nerves both in the front and posterior aspect. So these are the nerves which supplies the muscle that is present in the scalp, that is the frontalis and also the occipitalis. So in the anterior quadrant, the nerve that supplies the frontalis, it is the temporal branch of facial nerve. So that will supply the frontalis muscle. Whereas if you see the sensory nerves, there is a nerve called as supratrochlear and next to that there is a nerve called as supraorbital. Both are branches coming from the ophthalmic division of the trigeminal nerve, whereas there are two more branches coming from the maxillary and also the mandibular nerve. So one is called as zygomaticotemporal nerve and auriculotemporal nerve. So these are the nerves that are present in one nerve. So four sensory: supratrochlear, supraorbital, zygomaticotemporal, and also the auriculotemporal, and one motor, that is temporal branch of the facial nerve. So that means altogether there are 10 nerves in front of the ear, 5 on the right and 5 on the left side. So if you see nerves in the posterior quadrant, the motor nerve again is a branch of the facial nerve, the posterior auricular branch, which supplies the occipitalis belly or the occipitalis muscle. Whereas if you see the sensory nerve in this region, so most of these sensory nerves, they are actually branches coming from the either from the cervical plexus or directly branches coming from the spinal cord. So it includes lesser occipital, then there is third occipital, greater occipital, and great auricular nerve. So these are the nerves: lesser, third and greater occipital and great auricular nerve that supplies the posterior aspect. Again, in each of there will be 5 nerves, so altogether there will be 10 nerves in the posterior aspect. So next, if we appreciate the arteries that supplies the scalp, as I said, again it is divided into arteries that supplies in front of the ear and arteries that supplies the region posterior to the ear. So in the anterior part, along with the nerves of the same name, so there will be an artery called as Supratrochlear Artery, and next to that there will be an artery called as Supraorbital Artery. So both these arteries, they are branches coming from the ophthalmic division, they are branches coming from the ophthalmic artery, which is again a branch of the internal carotid artery. So apart from this, there will be an artery which ascends along with the auriculotemporal nerve, which is called as superficial temporal artery. So these are the 3 major arteries in one of supratrochlear and supraorbital branches of the ophthalmic artery, and superficial temporal artery, which is one of the terminal branch of the external carotid artery. Whereas the posterior quadrant of the skull, that is behind the ear, it is supplied by 2 branches, the posterior auricular artery and also the occipital artery. So these are the 2 arteries in one of the posterior auricular and occipital artery. Both of these, they are branches coming from the external carotid artery. So if you see the venous drainage, so there are similar veins: the supratrochlear vein, the supraorbital vein, superficial temporal vein, posterior auricular, and also the occipital vein. So occipital vein, posterior auricular vein, superficial temporal, supraorbital and supratrochlear veins. So these are the veins in the scalp region in the anterior and posterior part. So what happens to these veins? So where they will drain, all those details we will see it in the chapter of the face region. And finally, if we see the lymphatic drainage, so the part of the scalp in front of the ear, so it will drain mainly into the parotid group of lymph nodes. Whereas the part that is present behind the ear, it will drain mainly into the mastoid and even the occipital group of lymph nodes. So mastoid, it is also called as the postauricular. In simple words, you can remember it as preauricular lymph nodes in front of the ear, postauricular lymph nodes behind the ear. So these are the major features that you should know in this chapter of the scalp. What are the various layers? So what is present in each layer? So which is the dangerous area of the scalp? What is its nerve supply, sensory and motor? What is its blood supply, arteries and veins? And what is the lymphatic drainage? So do subscribe for future updates. Thank you.